I now call Jackie Baillie to be followed by Ash Regan. Up to 4 minutes, please, Ms Baillie.
Can I start by thanking Tess White for bringing this members' debate to the Chamber this evening. I had the opportunity to attend the event in Parliament a few weeks ago that she sponsored, where the Women's Research Network presented their findings to MSPs and guests, and I have to say that their findings were profoundly shocking. It's beyond question that our hospitals should be places where patients and staff alike know that they will be kept safe and treated with dignity. And as Tess White referenced, the report tells us that of the 288 sexual assaults and rapes recorded in Scottish hospitals in the past 5 years, more than half of them occurred on a hospital ward. The surroundings where these assaults took place included a children's hospital, 2 maternity hospitals and a palliative care hospital. And shockingly, as we've already heard, Police Scotland could only give details of 29% of cases, so that the real number of sexual assaults will be far higher but go unreported. The opportunity to commit sexual assaults, I believe, will be increased because we still have mixed-sex wards. For 20 years now, first Scottish Labour and then SNP administrations have required health boards to eliminate mixed-sex accommodation in our hospitals. Yet in 2024, only 2 health board areas, Dumfries and Galloway and Orkney, confirmed that they offered single-sex accommodation across all of their wards. The remaining 12 health boards which replied offered mixed-sex accommodation in at least some of their wards, a far cry from the pledge by the SNP. And I wonder whether the Minister now, or in her summing up, can tell me whether that situation has improved at all. If the SNP government had kept to its promise, we might not have the level of abuse that goes on in our hospitals today. How disappointing it is that women are let down, that even when the government commit to a clear principle, it simply fails to deliver in practice. So will the government commit to urgently working with health boards and Police Scotland to investigate the circumstances of these assaults, including whether they happened on mixed-sex wards? Will they ensure that there is more accurate recording and reporting in the NHS of sexual crimes as we go forward into the future? And what action will be taken to prevent these assaults from happening in the first place? This report demonstrates that our hospitals are not as safe as they should be. The reality is that too often women are stuck not even in mixed-sex wards, but actually in corridors. Most of you are aware of the recent report from the Royal College of Nursing, in which one Scottish nurse described having to use privacy screens around patients so that they could use the bedpan. As the director of the Royal College of Nursing Scotland said, and I couldn't agree more with these comments, this is completely unacceptable for patient safety and staff well-being. So, Presiding Officer, all that remains for me to ask is, will the SNP government live up to its long-standing pledge to end mixed-sex wards, or will we be here in a year's time with yet another report of increased numbers of women experiencing assaults in NHS Scotland?